Good evening. My name is Alexandria Hobbs, and I'm working with the University of New England as a student. Today's October 21st, 2018, and I'm going to present on my Madera County Community Assessment. So Madera County is located in the central San Joaquin Valley in the state of California. It is a relatively small county with a population of about 153,000. It's a very small county in comparison to the county, Fresno County to the south, which is about 1 million in population and double the size. It does consist of suburban and rural land. The majority of this land is either farmland or undeveloped rural land. There are a few major cities within Madera County, the city of Madera being the largest city, making up most of its suburban area. There are several resources within Madera County, including a county hospital. This hospital is a 116-bed hospital with a very small 16-bed ER. So many of Madera County's population either travels to north to Merced County to larger hospitals or south to Fresno County hospitals. Madera County is host to two State Center Community College District campuses, and these are two junior colleges, as well as has a large healthcare provider group called Camarina Health, and they kind of span the entire county of Madera with several health clinics, low-income clinics, psych facilities, urgent cares, dental clinics, vision clinics. They are definitely one of the leading health groups within Madera County. So moving on to demographics and the socioeconomic factors, the median age in Madera County is 33.5 years old. There is about 18% of the population that is over the age of 65 and about 18 to 20% of the population that is younger than the age of 18. So there is a good spread, but it's not anything different than we see maybe in Fresno County or in the state of California. Madera County is rather unique in that it does have a 56.2% Hispanic or Latinx population. This is significantly higher than the state of California. So when you're walking through Madera County or driving through Madera County, it's predominantly a Hispanic population that you're seeing. There are 93.3 males per 100 females, so females are definitely dominating in Madera County. And this is in comparison to Fresno, where there was 99 females or 99 males to 100 females. So there is definitely a little bit of a shift with females. The mean income within Madera County is $66,000 a year. This is slightly lower than Fresno County, which sits at about $70,000, but it's doing good for a county of its size within California's Central Valley. However, although the median income is $66,000, 25% of the population does live at or below the poverty line, and a lot of that population, 44% of it, lives in substandard housing. And so as you're driving through Madera County, doing kind of a windshield survey and doing those walking surveys, you're seeing a lot of kind of substandard housing. You're seeing a lot of infrastructure that is maybe old, deteriorating. There is a lot of public space, a lot of wonderful areas for the population to walk around and be around and hike, and a lot of wonderful things in Madera. However, a lot of the infrastructure as well as the housing is definitely substandard. And the employment rate, however, which is kind of in contrast to the 25% below poverty, is only at 4.2%, which is 4% lower than Fresno County, the neighboring county, as well as the state. So this is a relatively interesting kind of piece that the majority of Madera County is employed. moving on to community health. So the average life expectancy for someone living in Madera County is 80 years old. This is lower by 1 or 2 years based compared to the state of California. So not too much variation there. The highest mortality rates that we're seeing in Madera is the ischemic heart disease, stroke, self-harm or interpersonal violence, mental health disorders, and then diabetes, urogenital, blood, and endocrine diseases. And so that heart disease as well as the stroke, we're seeing mortality rates that are a lot higher in Madera County than we see even in Fresno County or in the state of California or even nationally. So those two are some areas that we're definitely going to focus on as we prioritize. What is interesting, however, is the diabetes. So Madera County did an initiative several years back where they were trying to lower the rates of diabetes, and they've definitely made an impact on this. The morbidity rate of diabetes has definitely decreased. Other health and personal behavioral risk factors are high amounts of alcohol consumption and binge drinking, high rates of smoking, obesity, and a lack of physical activity during a person's leisure time. And so smoking, obesity, physical activity, which are all the higher prevalence, have high prevalence rates, are all linked to that heart disease and that stroke. While the alcohol is correlated to the interpersonal violence. And so it's interesting to see high rates of morbidity correlated over to that high mortality rate. So as we kind of look at how Madera is in regards to its health, its socioeconomic background, as well as demographics, we want to prioritize a health issue. And so when looking at this county, obesity definitely seems to be a factor that's playing into several areas of Madera County's health. And so obesity is something that obesity is described as a BMI of over 30, and it is correlated and has adverse effects, including that ischemic heart disease, stroke, and diabetes. Diabetes, which we did see a decline in, where Madera County Public Health was attempting to make that decline. So that's really wonderful. Obesity does have several risk factors. The CDC outlines that persons of Hispanic or Latinx background, as well as someone who has not completed their college education, have a higher risk of becoming obese, as well as persons who, during their leisure time, are not choosing to do physical activity or live a healthy life, and including that physical activity. And so one of the things that we did just discuss is that Madera County, only about 19% of the population chooses to do physical activity during their leisure time compared to the state of California, where you're seeing a lot higher numbers in that. So what can we do about it? So obviously, like I said, Madera County Public Health Department did put through an initiative on diabetes, and they affected that change. So obesity is no different. So using those community resources is definitely something that Madera County is going to have to do to affect change. So utilizing Madera County Public Health Department for education, health promotion, and potentially a BMI program, which is definitely something that's cost effective. Utilizing Camarina Health, which is the biggest health resource within Madera County for education, promotion, and those free health clinics, trying to reach those maybe underserved populations. As well as United Way has a wonderful program in the Central Valley and in Madera County called the California Regional Obesity Prevention Program. And so this program advocates on behalf of environmental change to affect obesity. So making more walkways, making sure parks are available, making sure there's grocery stores, and working with the political leaders to make that happen. So thank you guys so much.